Welcome to The Explainer. Today, we're digging into a really important and tough question. Why does dementia hit the Black community so much harder? We're going to follow the research to unpack a story that goes way beyond just medicine. So let's just start with a number, a really stark one that kind of sets the stage for this whole conversation. Older Black Americans are twice as likely as their white counterparts to have dementia. That's a huge difference, and it really forces us to ask why. Yeah, when you see a number like that, you have to ask, why is this happening? And as you're about to see, the answer isn't simple. It's a really complex web of different factors that we're going to untangle together. Okay, so first up, let's really get a handle on just how big this disparity is. To get why this is so urgent, we need to look at not just where we are today, but where we're heading if things don't change. I mean, check this out. The CDC is projecting that by 2060, which is not that far away, the number of African Americans with dementia is set to be 4 times higher than it is today. 4 times. That's not some distant problem. That's a crisis building right now. So how do we start to unravel that why? Well, a huge piece of the puzzle is the connection to other health conditions. There's a really strong link between dementia and several other big risk factors. Think about it. Things like high blood pressure, type 2 diabetes, and heart disease, they all affect our vascular system, how blood gets to the brain. And here's the thing. These conditions are all, unfortunately, more common in the Black community. So you start to see how the risk just stacks up. Let's zoom in on one of these, high blood pressure. It's a major risk factor for something called vascular dementia. And when you look at the numbers, wow, the difference is pretty clear for both Black men and women. But what's going on underneath all that? What's driving this difference? And this is absolutely critical. We're not just talking about biology here. Not at all. A 2020 study actually suggests that the chronic stress from lifelong discrimination can physically lead to higher blood pressure. That's a direct line from a societal issue to a health outcome. And it's not just high blood pressure. We see the exact same kind of pattern with type 2 diabetes, another major risk factor. Again, twice as likely. It's just one more layer adding to that compounded risk we talked about. But, these health issues, they don't just pop up out of nowhere, right? They don't exist in a vacuum. To really get the full picture, we have to pull the lens back and look at the bigger, systemic stuff. And what we find is this whole foundation of inequality. We're talking about everything from the stress of everyday racism and where people are forced to live, to economic hurdles, and even, get this, the very tools doctors use to diagnose the problem. Okay, this is a really fascinating and frankly pretty troubling point. The actual tests doctors use to check for dementia, they might be biased. So why is that? Well, for one, a lot of these tests were created and tested primarily with white people. They often don't take into account things like different educational backgrounds or, crucially, the long-term impact of stress from discrimination. All of that can throw off the results. And it's not just the doctor's office. Sometimes the barrier is literally where you live. You've probably heard the term food desert, right? It's when you don't have easy access to affordable, healthy food. If your diet is limited because of that, it's going to be way harder to manage things like blood pressure and diabetes. And of course, money plays a huge role. Look at this statistic from 2019. 17.4% of African American families were living below the poverty line. Compare that to just 5.5% for non-Hispanic white families. That's a massive gap, and it affects everything. Access to healthy food, safe neighborhoods for exercise, good healthcare, you name it. Okay, so we've unpacked a really complex problem here with some pretty deep roots. So what do we do about it? Where do we go from here? Well, the good news is there are pathways to change. It really seems to boil down to a two-pronged approach. We have to tackle this from both sides. On one side, we need big systemic changes, things like making sure clinical trials actually include people of color and creating diagnostic tools that are culturally fair. But on the other side, there are also things individuals can do to protect their own health. So on that individual level, what can you do? The National Institute of Aging points to 4 really key things. It's about adopting a healthier diet, like the Mediterranean diet, getting more exercise, keeping that blood pressure in check, and, this is a fun one, keeping your brain active with things like puzzles, reading, or crafts. So when you put it all together, what's the big takeaway? It's that there's no single simple answer here. The dementia disparity in the Black community isn't caused by just one thing. It's this complicated mix of health factors, economic struggles, and deep-seated structural problems all tangled together. And all of this really leaves us with one final huge question to think about. Because when you start to unpack this one issue, you realize it's about so much more than just dementia. It's about figuring out what it's really going to take to build a system where everyone, in every community, has a fair shot at a long, healthy life.